From Department of Shalya Tantra, Shri Jagadguru Gavisiddeshwara Ayurvedic Medical College and Hospital, Koppal. Now I call upon Dr. Jitendra Sir, Assistant Professor, Department of Shalya Tantra, SJG AMC and Hospital, Koppal, for welcome speech.
It gives an immense pleasure to welcome the dignitaries of this guest lecture. Firstly, I heartily welcome today's president of this guest lecture series, Dr. B.S. Saudi sir, Principal and HOD, Department of Shalya Tantra. I welcome you, sir. I now heartily welcome today's guest speaker, Dr. Poornima Jalawadi ma'am, Associate Professor, JSS Ayurveda Medical College, Mysore, for accepting our invitation. It's our honor to have you, ma'am. I welcome you once again, ma'am. I also heartily welcome the director, Dr. Praveen Kumar sir, SJCMC Koppal, to this event. I also heartily welcome Dr. Suryanarayan sir, PG coordinator, SJCMC Koppal, to this event. I also heartily welcome to all my departmental staff to this event. I welcome all the PG scholars, UG students, and all the delegates to this event also. Thank you.
Thank you, sir. I also welcome you for the session. Now, our beloved principal, sir, and HOD, Department of Shalya Tantra, SJG AMC Hospital, Koppal, will address the session. Sir, over.
Good morning, all of you. So today, Department of Shalya Tantra organized series of guest lecture, Shalya Prabodha. And particularly today's session is a wonderful session, utility of Kshara in clinical practice. The good topic and good title. And I welcome and thank to Dr. Poornima Madam, Associate Professor, Department of Shalya Tantra, JSS Ayurveda Medical College, Mysore. My dear students and scholars, such clinical practical oriented the very important nowadays because particularly Kshara. In parasurgical procedures, everybody knows that the Kshara karma, Agni karma, and Jalavkacharana, Raktamokshana karma. See, apart from two procedures, Kshara karma is the most important procedure, particularly in parasurgical concern. So that's why such the Kshara concern, how to utilize this Kshara and in clinical practice is very important topic. The particularly Poornima Jalawadi madam is experienced regarding. So I wish to all of you and to because these everybody knows the quality of Kshara. Even the Sidoshagna properties, Chedana, Bedana, Lekana properties, all the properties the Ksharas with. So even though how to utilize this Kshara in clinical practice is very important, every PG should be properly listen and note it, whatever the points important explained by guest speaker, then only such the guest lectures, series guest lectures can succeed it. Only you are hearing the words, you are not put a note, important note. Simply you are hearing the words is not at all considered. Whatever the experience shared by guest speakers, you have to, all the listeners, all the PG scholars has to put a note, particularly this is very important topic and practical concern. How to utilize in clinical practice in Kshara is very important topic, very important parasurgical procedures. I hope everybody should properly involve and utilize this session. Then only such events are successfully completed. So that I uh, congratulate to Department of Shalya Tantra, Associate Professor Gitanjali, and Dr. Lohit, Dr. Jitendra, Dr. So many our department is involved. A series of guest lecture is conducting some more innovative and informative sessions will add definitely in forthcoming days. We'll conduct many more scientific sessions and practical oriented sessions. Definitely, we have to conduct, and we'll hope for the current science, what exactly Shushruta says, what exactly currently is available resources can use and applied your mind, then you can use the practice, then only it can possible to survive the society. That's why upgrade yourself and listen properly, note properly. I hope the madam is most experienced. Once again I welcome to Poornima madam to this session. I congratulate all the department, wishing the function grand success. Thank you.
Thank you, sir. Thank you so much for your advice. Stars shine at night, and some stars shine at bright daylight. And it's our pleasure to welcome such a star, our today's guest speaker, Dr. Poornima Jalawadi ma'am. It's my privilege to welcome you, ma'am. Ma'am has completed BAMS from Ayurveda Mahavidyalaya, Hubli in 2009, and ma'am completed postgraduate MS Ayu Shalya Tantra, Government Ayurveda Medical College in 2012. And ma'am has 7 years of teaching experience and 11 years of clinical practice, and currently working as an associate professor in Shalya Tantra Department, JSS Ayurveda Medical College and Hospital, Mysore, Karnataka. And ma'am has published more than 20 publications in national and international journals, and also attended 14 national and international conferences and workshops, and presented 2 papers and 2 guest lectures. And ma'am's area of interest is Vidya Agnikarma, Marma Chikitsa, Panchabhautika Chikitsa, and Hydrodynamics Suppurativa. Ma'am was a member of Institutional Research Committee for 6 years and organizing committee member in national seminars conducted in college in 2016, and conducted various medical camps in and around Mysore. RGH's research granted for various projects such as a double-arm open-label randomized clinical study on the effect of Trivikrama Rasa in the management of cholelithiasis as a principal investigator. A double-arm open-label randomized clinical study on the effect of Yava Paniya Kshara in the management of Yakrit Dalyodhara with special reference to non-alcoholic fatty liver disorder as a co-investigator, and student research as a guide to a trimmed plant scientist research protocol competition phase 2 on viscovas capsules, and guided 10 students for postgraduates as a co-guide and guide. With this note, wholeheartedly welcome Dr. Poornima ma'am, and we are very honored to have you ma'am. Now the session will begin. Over to Poornima ma'am.
Thank you, Dr. Kavya, for your warm welcome. Seeking the blessings from Shri His Holiness Suttur Mahaswamiji and Shri Gavisiddeshwara Swamiji, I would like to thank the organizers for giving me the opportunity for sharing my knowledge of Kshara in the clinical practice. Kshara is an... Can you see my laptop? Can you see my screen?
No ma'am, still no.
Okay. Can you see it now?
Yes ma'am, now it's visible ma'am.
So, Kshara is a It is an Ayurvedic formulation which is explained in all our classical texts. So Acharya Sushrita explains it in Sushrita Sutrasthana 11th chapter, and we also get the reference in Sushrita Uttara Tantra 42nd chapter, where the Paniya Kshara is more elaborately explained. So Kshara is one such topic which is boon to the current Ayurveda surgeons, and right from Yogya Vidhi to rhinoplasty till Kshara Sutra, the concepts have been snatched by Westernized and are revolutionized and developed it. So even though Kshara Sutra is replaced by Saturn, still the preparation of Kshara and Kshara Sutra is mysterious to them. And there lies the superiority of Ayurveda in the field of surgery. So, as a practitioners of Shalya Tantra or experts of Shalya Tantra, we all should be well versed with the topic of Kshara and its applicability, which is why Acharya Charaka call us as Kshara Tantra Vid. So he specifically mentions us, the Dhanvantari Sampradaya, as Kshara Tantra Vid. So it is our specialty and we should be proud of. So moving on to the definition of Kshara, we all have learned it since our UG days, that which is quoted by Sushruta, that to call it as a Kshara, it should have two properties. That is, one is it should produce Ksharana on the tissues and it should produce Kshanana on the tissues. So Ksharana means it should produce corrosive effect on the dhatu, where the dhatu will be dhatu shatana will be there, or dhatu chalana will be there. And Kshanana means it should produce the himsa to the dhatu. Then we call it as Kshara, and that is when it produces two effects. It is done in the intention of healing the dhatu or to cure the element. So that is the definition of Kshara that we all know. Then coming to the Kshara Pradhanyata, as Savdi sir told, so Kshara is Pradhanatama among all the Anushastras and the Shastras. So Sushruta quotes three factors for that. One is Chedya, Bhedya, Lekhya Karanat. That is, out of 8 Ashtavida Shastra Karmas, Chedana, Bhedana, and Lekhana is done by alone Kshara Sutra itself, and which is in very easy manner also, and in the milder form. So that is why it is Shrestha. Then it is, second factor is Tridoshagna, where it does not alleviate, it does the Prakopana of Pitta. Then the third factor is Vishesha, that is special. Kriya means the treatment. Vishesha Kriya Avacharana. Avacharana means procedure. So Vishesha Kriya Avacharana, to say or to repeat it, the special treatment modality of the Kshara makes it Pradhanatama. So Pradhana Anushastra is Jalauka, Pradhanatara is Agnikarma, Pradhanatama is Kshara. Always it is Kshara. So this is why the Kshara is more important, because of its Vishesha Kriyavacharana, as it can be used in Lepa, Sutra, Pichu, Pana, etc. And for this, Dalhana clarifies that Vishesha Kriyavacharana is attributed because of its it can be used in Pittashas, where it does not do the Pitta Prakopa, and it can be easily done in the Pittashas. To this, we get the clarity of Vishesha Kriyavacharana when in the Pathantara, that he says, Shastranu Shastrani tu Pane na upayujjante. So he clearly tells that no other Shastra and Anushastra is consumed orally except Kshara. This is the Vishesha Kriyavacharana of Kshara, and it makes the Kshara Pradhanatama among all the Shastra and Anushastra. And Acharya Vagbhata further clarifies the Vishesha Kriyavacharana as Chedya Bhedya Karmani Kurute Vishimeshu api. That is, So Chedana and Bhedana karma is done by the Kshara in the Vishama condition, that is in non-favorable conditions. So even in the Vishama non-favorable conditions, we can easily do the Chedana and Bhedana. And further he says that Dukkavacharya Shastreshu Tena Siddhi Mayati. That is when Dukkavacharana. So when the Shastra Karma is very difficult to produce, there the Kshara acquires Siddhi. That is without any failure, we can treat the patient if we use the Kshara. So that is why the Kshara is Pradhanatama among Shastras and Anushastras. Then moving on to the Kshara classifications. So we all know that the Kshara is divided as Paniya and Pratisaranya depending upon the route of administration. It is divided as Mrudukshara, Madhyamakshara and Tikshna depending upon its Virya. Then moving on to the Kshara preparation. So the Kshara preparation can be done by the using three materials, that is Apamarga Kshara in case of Apamarga Kshara preparation, or Shukti or Shankanabi, and then Chitraka Mula. So if we want to prepare a Mrudukshara, then the plant alone will be sufficient. And if we want to prepare the Tikshna, then only three materials are required. Then coming to the Kshara preparation, it is the modified method. Sushruta tells it is Drona and Kudava Matra Kala. But nowadays it is very difficult to analyze the Drona and Kudava. That is why in modified method, we just the proportion, all the method is same, but only the quantity are expressed in the current standard international units, that is in the kg, that is the weight, or capacity, that is the liters. So that is the only modification. It is still, it holds good as per the classics, but to be for the easier understanding of the students, Dr. Parvaja sir has formulated this formulation. So if we take 5 kgs of dried Apamarga plant and if it is burnt, then we may get approximately 500 grams of Apamarga Kshara. So for that, Apamarga ash or Bhasma. So to that, we should add the 6 times of water. So the 6 times of water here, most of the students will weigh the 500 grams and they will multiply by 6, it becomes 3000, and they will add 3 liters of water. So that is the commonest error which is done by the students, but it is in our classics, it is always told as the volumetric. So we should take the Avamarga ash in a container, and in that container, we should add 6 times of water. That is important to get the Kshara in a potent form. Then that should be left for overnight, and it should be filtered for 21 times through a cloth till we get the clean and clear solution of Gomutra Varna. So the Gomutra Varna is usually slight reddish in color. So this Gomutra Varna, when it's obtained, the filtrate solution is kept for boiling. So if we stop the procedure at this, we will get the Pradukshara, which can be used for the Pana. And if we want the granules, we can just evaporate the Kshara and we can pack it in a capsule for the Paniya Kshara. If we want a Madhyama Kshara, then once the 2/3 of the filtrate remains, 1/3 is evaporated and 2/3 when it remains, then we should add the red hot lime, that is Shankanabi or Shukti, or the limestones should be added. 50 grams of it should be added to it should be heated to red hot and it should be added to the filtrate. Then the heating should be continued. Once if this is done, then if the filtrate is taken for the treatment, that would be the Madhyamakshara. To make it Tikshna, once the filtrate reduces to 1/3 of its original quantity, then we should add the 5 grams of Chitraka Kalka, or that is the 1/10 of that total proportion. Then we will get the Tikshna Kshara. So this is the simple step and the proportion we should bear in mind to get the good quality of Kshara. So we shall see this. So the Paniya Kshara, pictorially, you can see it is the plant is dried, the panchanga of the apamarga was taken, and it was completely burnt. So this is the ash. So we should remember that the the ash which we get should be the whitish gray in color. So if the kshara, the bhasma which we get, if it is black in color, then it will have more of the carbon particles. So that will yield less potent kshara or the less quantity of kshara. So the main important thing to be remembered while preparing the kshara is we should always get to the grayish white ash. So if that is possible only when you completely dry the plant in shade. So if the plant is not dried completely, then you will get the blackish ash, and there the kshara quantity will be very less, and it will also be very less potent. Then once the grayish white plasma is obtained, that should be soaked in 6 times of water by measuring it in volumetric. So it should be soaked and it should be kept in overnight. Then on the next day, we can filtrate it for the 21 times. Better you remember till we get the Gomutra Varna. So there is a reason why it is told in our classics that it should be kept for boiling only when we get the Gomutra Varna, which I will discuss later. Why all these exact steps are told in our classics and how they are very scientific. So the filtrate should always be in a Gomutra Varna to get the best Kshara. So once it is kept for boiling, if it precipitates and if we get the powder, that will be the Paniya in the Paniya Kshara in the Mrudu form, Mrudu Virya. Then going on to the Pratisaraniya Kshara, Tikshna Pratisaraniya Kshara. So the same steps are there. You can do this. The Shukti is heated to red hot, and it is the Prativapa is done in the Ksharodaka, which is there, and then the continued boiling. You can see that the color of the filtrate has changed to the Shukla Varna, or the whitish color. The, that is the reason why Sushruta has told it as in Ashtaguna of Kshara, it should be always Shukla to say it as the good quality of Kshara. So this white color indicates some chemical reaction, which I'll be telling you further. So if at this, once the 1/3 of it remains, if we add the Chitraka Kalka 5 grams, then this we will get the Tikshna Apamarga Kshara. Okay. So as I told you, there is a reason for the exact steps told in our classics. So we do it blindly, and we do it because it is Aptapadesha. But the reason was studied by the scientist, Professor A.R. Vasudeva Murthy, and he told us why filtration, why Shakti, and why Chitraka Kalka, and it was supported by various scientific articles, which I will be discussing now. So this is because, so in his textbook, he's Professor A.R. Vasudeva Murthy, who is a scientist in Indian Institute of Science, and he is the pioneer for silicon development in our India. So he, in his book, tells that in the Indian tradition of chemistry and chemical technology, he says that the wood ash are rich in potassium and sodium carbonates. So they are rich in potassium and sodium carbonates. And when we mix the ash with the water, there will be reaction going on between the wood ash and the water, which produces potassium hydroxide and alkaline hydroxide in traces. So that is why we will keep it for the overnight till it settles down, and the reaction keeps going on between the wood ash and the water. Then when we start filtering it, what happens? Through the filtration, the insoluble particles like silica will be separated. So all the insoluble particles like silica will be separated, and when we attain this Gomutra Varna, this filtrate solution will be rich in potassium and sodium hydroxides and potassium carbonate and sodium carbonates. So this is why our acharyas have specifically told to wait till we get the Gomutra Varna. So the wood ash, when mixes with the water, it produces alkaline hydroxides. You know that when the base is very strong, if it has the hydroxide group in its component, that is either it may be sodium hydroxide or potassium hydroxide, and these hydroxides will be present in this Ksharodaka in traces. So that is why it is used when we don't add anything, it can be used in for paniya. So that is why this Gomutra Varna Kshara Sharodaka will be slimy in nature, because it contains these components, and when we touch it to the tongue, it will give the tingling sensation to our tongue. And there are some certain cases reported that the toddler, when he played in the wood ash, he got contact dermatitis because of this alkaline hydroxide. As the water mixed with the water gun was sprayed over the boy in the wood ash, and he was playing in the wood ash, and the with the water gun, he was washed, and he developed contact dermatitis because of the trace alkaline hydroxide present in that water. So this will be mrudu. If we heat it, it will be mrudu in virya. So to increase the viryata, to higher the concentration of potassium and sodium hydroxide, that is alkaline hydroxide, so what we do is we will add the Sudhavargiya Dravyas, that is Shanka, Shukti, etc. So all these Shanka, Shukti, seashells or limestones are rich in calcium carbonate. So they are all rich in calcium carbonate, and when they are heated, they decompose. They decompose to form a calcium oxide, which is nothing but a quicklime. And when they are heated and they become decomposed, it will give some fumes will be coming out. That is nothing but the carbon dioxide will be liberated into the air. So then we will heat it to red hot, and we will pour into the uh, filtrate solution that we are preparing, right? So once we pour, what happens? We will ask the students to move away, because it will be very much vigorously boiling. So that is the vigorous reaction that would be taking between the calcium oxide and the water. So once the calcium oxide or the quicklime is poured into the water molecule will react with it to produce vigorously to produce the calcium hydroxide, which is nothing but the lime water. So that is the reason why we do the prativapa. Okay, so this calcium hydroxide, again the hydroxide is very active ingredient, and it tries to settle down by making the reacting with the calcium carbonates which are present in the filtrate, which are not reacted, and they are just they are present in the solution. So this potassium carbonate and the calcium hydroxide, they react with each other to produce the precipitate of calcium carbonate. So that is why the color changes to the Shukla Varna. So the calcium carbonate, once it produces, it will start precipitating it, and the supernatant fluid which is present will be rich in potassium hydroxide. So this is the reason why the supernatant fluid, if it dries out, we call it as the Kshara is impotent, has lost its potency, and we will borrow Ksharambu or Ksharodaka from those who are preparing Kshara, and we will put it into the Pratisarniya Kshara if our Kshara is dried, because it is very rich in potassium hydroxide, and these hydroxide groups are very reactive, and that is where the Dagdata or the cauterization begins. So then if we stop it here, it will be a Madhyama Kshara. Then if we continue by adding the Chitraka Kalka, then the Chitraka Mula Kalka is very rich in plumbagin or isoplumbagin. Both it will be very rich, and that will react with the potassium hydroxide to increase the potassium current, and that leads, when it comes with the mucous tissue, it leads to the depolarization of the membrane, and it brings the apoptotic changes in the mucosa. Apoptosis is nothing but the death of the cells. So that is how the necrosis is begin, and it is potentified by adding the Chitraka Mula Kalka. And that is why the Tikshna Kshara is able to do the cauterization within Shatamatra Kala. So this is the reason why we add all this into while preparing the Kshara, Tikshna Kshara, and we are all well versed with the effect Chambufala Varna and all, but we don't know much of the scientific facts which are told, and the Sushrita was the Acharya who has clearly and specifically told all these groups, all these methods, and it works wonder even today. Then moving on to the preparation of Kshara, Sutra. So it is the only method which was standardized in the field of Ayurveda for the treatment of Kshara, for the treatment of Pagandhara. So this you can see it here. So the barber thread was taken and it is tied to the hangers. So making sure that it is completely tight, and 11 coatings of snowy Kshira, and 7 coatings of Apamarga Kshara, and 3 coatings of Haridra was smeared, and it was sterilized by irradiation of UV light. So this we all know, and we will be preparing. Then moving to the properties of Kshara. Now I think we all know that why the Varna is Shukla, why it is Tikshna, why it is Agneya, why it does the Dahana, Pachana, Dharana, Vilayana, Shodhana, etc. So because it has so much of active ingredients, the taste or the rasa is Katu, and because it causes because it has so much of alkali, it is Ushna in Virya. Now coming to the Paniya Kshara indications. So the Paniya Kshara is indicated and it is told in many of the diseases like Gara, Gulma, Udara Roga, etc., which you all are well versed with. And I'll be taking you to the practical utility of Paniya Kshara, which we practice in our OPD. So this patient, 57-year-old male, had presented to us with the complaints of burning micturition, colicky pain from loin to groin, and on ultrasound examination, it revealed 11 mm and this you can see 3 mm stone. So this urolithiasis was uh, obstructed in the VU junction, vesico-ureteric junction. So as you can see, there was no significant ureteronephrosis. So we opted for the Ayurveda treatment by prescribing Kshara 500 mg BD along with the Varunadi Kashaya. So after 3 weeks, the patient was completely devoid of all the symptoms, and the USG report revealed that he was free from the urolithiasis. Then moving on to the Paniya Kshara, can also be used in the cholelithiasis, where the cholelithiasis, the patient, she was 37-year-old female who presented to our OPD with the pain abdomen, colicky pain, and fullness of stomach, nausea, and burning sensation in the chest since 2 days. She was admitted in a emergency ER for 1 day for observation, and she had taken all the antiemetics and the PPIs intravenously, and she was advised to go for the cholecystectomy. So yeah, as you can see the date, it was in the COVID time, and she was scared to death to go for the uh, cholecystectomy, and she was very scared to undergo cholecystectomy. Hence, she approached our hospital, where along with this, where the USG was again repeated, measuring the 6.3 mm of stone was multiple calculi, with largest measuring 6.3 mm. So then I had given her the Kokilaksha Kshara with Falatrikadi Kashayam, and then it was given for 30 days, and after the 1 month, you can see that the reduction of the size is 2 to 3 mm. So the largest measuring was 2 to 3 mm, and she was completely devoid of all the symptoms, where she, at the end of the 30th day, she started occasionally eating the non-vegetarian food. So usually the non-veg food triggers the pain abdomen. So she was able to take it and she was able to digest it. She did not had the fullness of, and even the cystectomy could be avoided, and she continued the treatment for one more month, and now she is living a normal life. So that is the importance of Paniya Kshara in the clinical practice. And in our department, we have conducted couple of researches on the Palasha Kshara and Punarnavadi Kshara Prayoga in the urolithiasis, where we had encouraging results also. Pratisarniya Kshara, these are all the indications we find in the classics. So the 29-year-old male presented to us with multiple warts. Okay, so he had this multiple warts since 2 years. So he had consulted 2 dermatologists, where he had given topical application of salicylic acid, and even he said that he had undergone the injection therapy, but it all was in vain, and patient was very much desperate to get a cure and get rid of all these warts, which are easily visible to the others, and he was hesitated much. So we asked him to go for the Virechana course. One complete Virechana Kaya Shodhana was done, and then after Samsajana Krama, patient was advised for the Kshara Prayoga. So the Kshara Lepa was given to him, and he was taught how to apply it, making sure that he doesn't uh, make the apply the Kshara in the normal skin. So with the earbud or a stick, he should apply only over the warts, and it should be neutralized by counting 100 with the Nimbuswarasa. So it was done. The patient was asked to apply the Kshara at home daily once. So after 1 week, he had good result, but some of the wards were reluctant. So he himself started applying the twice a day Kshara at home, and then after 2 weeks, you can see the complete eradication of the viral warts present over the hand. So even now the warts are not recurred, and the patient is very happy. Then coming to the Kshara Taila Prayoga in warts. So he was 15-year-old boy presented to us with this viral warts, which was uh, present since 2 months. So this history was very uh, a recent one. So he also consulted the dermatologist where they had given the salicylic acid, but he used to go to the football classes in Mysore. So he was very much eager to get rid of this among his peers. So I planned him for the Agni Karma. So the first sitting of Agni Karma was done, and after post Agni Karma on the day of Agni Karma, and the next day and the third day, I had asked him to give the apply the WH5 gel, and because it was very much hard and it was scattered, I had asked him to apply the Kshara Taila from the fourth day onwards. So first the Vranachikitsa was done, Dagda Vranachikitsa. Once it was like okay, the Dagda Vrana was okay, I asked him to apply the Kshara Taila over the fingers at least 3 times a day, and make sure that he doesn't expose to dust when he is applying the Kshara Taila. So that instruction was given, and after 1 week, on the 8th day, he should come again for the Agni Karma, and in 2 sittings, you can see the Agni Karma had worked wonderfully along with the combination of Kshara Taila. Then coming to the Ksharavarti Prayoga in pilonidal sinus, so that this patient had undergone the PNS excision, wide excision in our hospital, and while the patient was healing very good, he had some avasadhana in the vrana, which had to be curated, and which had to be it had to be vrana shodhana had to be done. So we planned for the Kshara, Apamarga Kshara, along with the Snuhi, Kshira, we mixed it, and we put it in the almost small avasadhana which was there in the Nadi Vrana. So there we did it for around 3 sittings, and along with the regular dressing, we used to keep the Ksharavarti, and the wound healed wonderfully in the post Ksharavarti application. Then another form of Ksharavarti which you can prepare at your clinics could be the combination of the what we use for Kshara Sutra, that is Nuhi Kshira, Apamarga Kshara and Haridra, and this was done in the auricular sinus, which was prepared and which was kept for the dressing. And if you don't have this Apamarga Kshara in a powder form, and if you don't get the Snuhi at once, you can also use the Ksharavarti. You can also use the Ksharavarti in the For emergency, you can use the Ksharavati and you can place it where you have to go for the wound dressing, and then you can switch to the other forms of Ksharavati which I told you in the other previous slides. So this you can, like, if the Kshara and if the wound is not healing properly, then you can apply it and you can go for the next. So you can even that patient with fistula in, where the Vati was kept, the wound healed very good with very good results, and you can see the pic at the end of the video. Okay, so it is not there. Next is Ksharalepa in recurrent PNS. The recurrent PNS is nothing but pilonidal sinus. So he was 32-year-old patient who presented to us with previous surgery, almost done a year back, and within a year he developed the lesion again, and we planned for excision with the application of Kshara, and on the post of second day again the slough was present. So the second setting of Kshara was done on that day, and after 1 week it was almost healed, and at the end of the 3 weeks the patient had healed completely the PNS, and even after 4 years the patient doesn't have any recurrence. So now coming to the Pratisaraniya Kshara Prayoga in hydronetis suppurativa. So she was 28-year-old patient who had this hydronetis suppurativa. So she developed a boil in the axilla, and then again she developed another boil at the perimenstrual period, and since 2-3 months she developed 3 pidekas in the axillary region. So she consulted the dermatologist, where she was referred to the surgeon, and there that diagnosed it as hydronetis suppurativa, and it was told that it is like it is very difficult to get 100% cure. So she approached to us, and I had planned for the Virechana, and then during the Vishramakala itself, I planned for the Agnikarma, or the de-roofing of it. So it was the upper part of the sinus was removed, excised, and the base was curated. After the curation, the Kshara was applied. So this was after 10 days, and this is after at the 20th day the patient had the almost the wound was completely healed. So she had the Vadibala in this patient was very less, so she had come early. So within 20 days the wound was completely healed, and the patient is living a normal life. Then this was the patient of 41-year-old female who presented with hydronetis suppurativa since almost 2 years. So she had this hydronetis suppurativa in both the axilla, and so she presented with the 2 tracks initially, and as the days passed she had around almost 5 tracks. You can see it on the right side of the patient, and on the left side this patient had also had multiple tracks which was present on the left side. So we had done the Kshara Sutra, like transfixation. Along with that, so along with the Kshara Sutra, we used to ask the patient to do the flush with the Gomutra. So Gomutra Arka and betadine wash was given for daily dressing, so that it flushes off the slough which is present since so many days. So his husband used to call this triangle as Bermuda Triangle, which is present on the left. So he used to update us with how this wound is and how the what was the amount of pus that we got. So it took around 6 months to almost get to this condition. So after 6 months, you can see that the patient was completely she got rid of the hidradenitis suppurativa with no recurrence since a year. So it is that is the one good thing which is worked for the patient. She had visited many surgeons, and there the patient had been told that there'll be recurrence and there'll not be any. We don't assure you for any treatment for hidradenitis suppurativa, and since almost 1.5 years, the patient is not having any recurrence. Then coming to the Kshara Purana in blind fistulous tract, the patient had undergone the Kshara Sutra therapy, and then he developed a tract, but on betadine push and the methylene blue with hydrogen peroxide, the internal opening was not found. Hence, the patient was taken for the Kshara Purana. So the Kshara was pushed into the track and then waited for Shatamatra Kala, and then it was neutralized by the Nimbusvarasa. And it was the Dagdavrana Chikitsa as like Varti pressed in, soaked in Jatedi Taila was placed, and the wound was completely healed, as you can see in the picture. So in the same way, I had a patient around 5 years back where the patient had the extension, female patient who had extension in near the vagina, but there was no vaginal opening. The opening was not found. So same way, that patient was referred to me by a general surgeon from a government hospital, and I did the Kshara Purana in that patient because the general surgeon had already done the fistulectomy thrice, and that was the fourth time she was getting the recurrence. So we did the along with the Kshara to treat the extension to the vagina. I did Kshara Purana, and it was neutralized in the same way as you saw in the video. Then the patient was treated with the regular sittings of Kshara Sutra. She took around 5 sittings, and then the fistula tract completely healed. And almost since 5 years, she comes almost every year for the checkup and just to meet and just to chat. But there is no recurrence since 5 years. Then this is the recurrent pyogenic granuloma. 62-year-old male patient had a thorn prick while he was working in the field. So he had this thorn prick, and he continued to work in the field with the fertilizers and the insecticides without covering without covering the wound. So the patient was non-diabetic, so he neglected it, but he had that habit of chewing tobacco. So as you can see, it is a left arm. He used to rub the tobacco in his left arm, and he used to consume it. So that consumption of tobacco and the fertilizers might have irritated it, and he started noticing a growth from the wound which is protruding out of the wound, and he consulted at the local surgeon who cauterized it. So and after 1 week, instead of healing it again, the flesh started coming out of the wound, and then he was referred to the Manipal hospital at the Mangalore. So there they excised it and cauterized it, and it was sent for the HPE to rule out the any malignant changes. Then the patient was told that there is no malignancy and you can take the post-op care can be taken as the wound dressing itself. So then he came to Mysore for his relative house, and then instead of healing, the mass came out, like the fleshy mass came out of the wound, and that used to bleed because in Bangalore they didn't give him any report because he had the tobacco chewing. So I sent him for the FNAC, and which said that it is a benign vascular growth. Then and it was advised for the excision biopsy, suggested excision biopsy. So we did with local anesthesia local anesthesia with adrenaline, the granuloma. So we had diagnosed it as granuloma because it is a proud flesh. Granuloma is nothing but because when the wound has irritation, it comes out as a proud flesh, and because it is a healing wound, there will be bleeding. So as it was confirmed by FNAC, it is as benign. So I excised it and I applied the Kshara. So when he saw the cautery machine, he said, "No, I have done it for 2 times, so it will come out." And so I told him that we will be applying a paste and it will not recur. Then you can see after 2 months, you barely notice any scar here. And the mass was sent for biopsy, and it was confirmed that he had the pyogenic granuloma. And then this is the case where 17-year-old female presented. She had the painful mass around the anal canal, and because she was menstruating, she was hesitated and she didn't tell her mother about this, and she waited for 3 days. On the 4th day, because the pain was unbearable, she told her mother, and her mother was worried, and she waited for another day. So she came to our hospital on the 5th day of mass. So you can see the induration here, and this perianal abscess had extended to the vulvar region where there was pressure necrosis, and the vulva was almost necrosed. So we took a gynec opinion to rule out whether the Bartholin gland is involved. So as there was no involvement of the Bartholin gland and the Bartholin cyst was not found, so we just did the IND, and the drainage of the pus was done. After IND, I applied Kshara. So that Kshara after the Kshara for daily dressing, I used to flush the cavity with Gomutra Arka. So the dressing was done with the Gomutra Arka for the initial days to remove the slough which was present, and around 10 days you can see the Vrana has obtained the Shuddha Vrana Lakshana, and then he got it healed very nicely. So coming to the next case, she was 50-year-old female who had this mole since her birth. So I told her that like she wanted to get rid of this mole at the age of 50, and I told her like and another condition of it was she should not have any scar for this. So the only option for us was to go for the Kshara, and we taught her how to apply the Kshara and how to neutralize it. And after 2 weeks, you can see there was no scar mark was there, and the mole had gone. So these are the some cases which which we have practiced, and which we have seen in our OPD with good results. So and other branches like Shalya Tantra, even the Kshara can be used for tonsillitis, and in Prasuti and Prasuti and Sriroga, even the Kshara is used for the cervical erosion. So these are the practical utility of Kshara, which can be done in OPD basis. So I've not included the usual Kshara for Archers, Bhagandhara, which we all will be well versed with. So these are all indications for the Kshara. Coming to the contraindications, So the contraindication makes us a better doctor because we should always know our limitation, where to apply and where not to apply. So where not to apply plays an important role to become a successful doctor. So the contraindications of Kshara are, according to the disease, it is contraindicated in Jwara, Atisara, Hridroga, Murdaroga, Pandu, Aruchi, Timira, Raktapitta, Pramehi, Kshatakshina, etc. Then, according to the physical and mental state of the patient, it is contraindicated in Bala, Vriddha, Asaishna, Bhiru, Rutumati, and Garbhini. And Sushruta specifies that even the patient is in the disease is indicated for Kshara karma, and if the patient's physical state has the Shunagatra or Atishula or Annadvesha or Udaya Sandhi Pidodhrita, then it should be contraindicated and we cannot go for Kshara karma. So that is the one we should bear in mind. So if we do the Kshara karma in such contraindications without analyzing the patient and without analyzing the disease, then we may end up in the complications. So like Dalhana wants us that if we apply the once, as I told you, we should apply the Kshara till it gets the Shuddha Vrana Lakshana. So if the Shuddha Vrana, in over the Shuddha Vrana, if we apply the Kshara, he wants us that there will be Kshara, Sira Kshanana and Shonita Srava Bhaya will be there. So in the commentary, he specifically warns us that. So that is the complication that we may encounter. Then Sushruta himself says that the Ati Sevana of the Kshara will lead to Pumsatva Nasha, which we should bear for, because of the legal issues. Then if the Kshara Prayoga is not done properly, and if the Hina Datta is done during the Pratisaraniya, then there will be Vyadhi Vriddhi. There will be, because there will be irritation to the tissue, and there will be proud flesh will be there. So the Vyadhi Vriddhi will be there along with the Toda and Kandu. Then if we do the Ati Dagda, then the patient may end up in Daha, Paka, Raga, Srava, Murcha and Marana also. So these are the complications that the one surgeon may encounter. So we have to be very careful in applying the Kshara by using our Yukti. So most of the Kshara Karma can give us wonderful results only if we use the judiciously, if we use the Kshara. So to sum up, so the Kshara Karma can be a OPD procedure mostly requiring the local anesthesia with promising results with no recurrence at affordable price with painless and minimally invasive surgery. So that is the beauty of Kshara. And I would like to conclude with a take-home message that the Kshara is the double-edged sword. So it has the benefits at one side, and it also has a risk on other side. So which Sushruta calls it, Sushruta and Dalana calls it as Mahadosha. So it has a benefit on one side, and on the other side, it also has the risks. So he tells that Visha Agni Shastra Ashani Mrityukalpaha Ksharo Bhavati Alpamati Prayuktaha. So it kills a person like a Visha by spreading the Vedana over the body, and it kills like a Agni by producing Visphota, and kills the person like a Shastra by producing Chedana, and it kills like a Ashani or Vajra by producing instant death. Yet, he continues that if it is used by Sadhimata Samyak Anuprayukto Rogan Nihantyat Achirena Ghoran. So if it is used by a Dhiman Vaidya by applying his yukti, he can cure a Ghora Vyadhi, Achirena Ghoran. So even the Ghora Vyadhi can be treated within no time, Achirena, within no time, like a magical wand. So it is up to us how we use the Kshara in our clinical practice. Thank you. If you have any doubts, we can have the discussion.
Thank you so much, ma'am, for wonderful session. And we all got to know about different aspects, in detail about Vishesha Kriyavacharana and what the common errors we do in preparation of Kshara, like in adding water, how much we should add, and what are the standard values in nowadays we can take. That all we got to know in detail, and how to use Kshara in different diseases in clinical practice. And once again, thank you so much for your astonishing session, ma'am.
Thank you, ma'am.
Now the session is open for discussion. If anybody has any doubts about particular topic, one can message in chat box or unmute and ask yourself. Ma'am, question ma'am. Which Kshara is used for Purana ma'am in Guda Purana?
No, it is not Gudapurna. It is in the Nadi, we have used the Apamarga Kshara along with the more of Ksharodak.
Ha
And
ma'am, in that what Kshara you have used there?
Apamarga Kshara with little dilution with NS.
Okay. Ma'am, in renal calculus, you have given Yavakshara. How you have prepared it, ma'am? There.
Ayurveda, we had given them the regular, which is available in the market. We here have NKCA pharmacy. Ayurveda is available. And even in a cholelithiasis, the VHLA pharmacy, which is certified one, we have given the Kokilaksha Kshara, which is ready-made.
Okay. In Grahani, how Kshara is indicated, ma'am? In
So in Parpati Kalpana, we can go for it. So Grahani, it will help in healing the ulcers. So if the Pitta Prakopa is ruled out, then we can go for the Parpati Kalpanas. Depending upon the avastha, because there will be Mahur Baddha and Muhrudrava. If the patient is having more of the Baddhata, at that stage we can go for even the Sajjik Kshara, like Hingu Vachadi. If we use, so Hingu Vachadi has Kshara Dvaya. So Sajjik Kshara is one of it, and the Malabaddhata can be cured there. And if the patient is having Dravata, then we don't go for Kshara Prayoga there.
ma'am, about the Vrana Ropana by Kshara, ma'am.
So in Vrana Ropana, it causes the Vrana Shodhana, and it removes the sloughs so and so easily that it promotes the wound healing. So as I told you, the Dalhana is commented that if the patient has having good granulation tissue, and over that if you apply the Kshara, then there will be Sirakshanana and there will be Shonita Srava. So it acts as the Vranaropaka by causing Shodhana effect over the Dushta Vrana by removing the slough.
Ma'am, how to treat infected umbilical sinus?
In any infected umbilical sinus or anything, first we have to remove the, usually there will be some, in umbilical sinus, even the PNS, pilonidal sinus, like there will be tuft of hair. So whatever the foreign body is there, if it is a puya, we have to remove the puya, we have to drain it. If there is any hair follicle or hairs are there, that has to be removed. And then we go for the Shodhana. The Shodhana can be done with any of the Shodhana Tailas. Even Kshara, if you feel it as appropriate, then we can go for Shodhana and then Dropana. But we should know that if there is umbilical sinus, if there is any patent urachus, or if it is communicating with any other organs internally, that we should rule out that it is the sinus is obstructed and it is superficial. If it is very deep and if it is communicating with the internal organs, then the surgery would be the best.
Ma'am, how Kshara can be applied on mole and whether it is after scraping or what, ma'am?
No. In mole, it was just applied with the application of Kshara. That's it. So with using a small stick over the small area, we have to ask the patient to apply, and it will gradually it does the Lekhana karma, and then it itself does the Chedana karma. It falls off on its own.
Any special precautions means can be taken for diabetic for Kshara Karma?
Yeah, the patient should be in euglycemic condition. So before going for any Kshara or any other Shastra or Anushastra karmas.
Ma'am, how the Kshara Jala Prayoga on Mashaka? Have you any experience, ma'am?
Yeah,
Kshara Jala Prayoga
Jalla Prayoga I have not applied.
on Mashaka, ma'am.
No. Kshara Jalla I have not applied. Even the Mashakya can also be like a mole or tilakalaka, or like it will all be like a small pigmented area. Then we can go for like, which should be done cautiously with the Pratisarniya Kshara only. I have not treated with the Kshara Jala.
Ma'am, on what basis you have decided the different Kshara as like a Kokilaksha Kshara in cholelithiasis?
Yeah, Kokilaksha Kshara is explained in Gulma Adhyaya in 42nd chapter, along with the Mulaka Kshara and all. There he explains it as Paniya Kshara in detail. So one study was in my study. I had taken the which was granted by Rajyachas, where I had taken one group with Trivikrama Rasa and one group with Kokilaksha Kshara as a Anupana. It was the established group in my trial because it was done in other universities and it had got good result. So I took it as an established group, and there were wonderful results in it.
Ma'am, can umbilical granuloma can be treated with Kshara, ma'am?
It
Umbilical
depends.
granuloma.
Yeah, it always you assess the patient, and then you should know the cause. And if it is in our limit, then we can treat it.
In Tilakalaka, Kshara can be applied or not, ma'am? In
Yeah,
Tilakalaka.
I've shown you the mole.
In cervical erosion, Ksharalepa is advised while performing. Should we take any special precautions in cervical erosion?
Cervical erosion, which I have seen, is done by a Kshara powder, which is available in the market. So the Kshara powder, which is available in the market, is a Paniya Kshara. That means it is Mruduk Kshara. So Mruduk Kshara can be applied, and it will be mixed with the NS and it will be applied. So that is what I have seen, and it gives good results. And it is usually done in 1 or 2 settings, not at a once.
Ma'am, any standard operating precautions for Kshara Karma in cholelithiasis regarding size of the calculi and period?
Okay, so always the what you should bear in mind while treating the cholelithiasis is, if it is more than 10 mm, it may lead to the carcinoma of the gallbladder. So you cannot treat it because the risk doubles. CA of gallbladder doubles with a size more than 10 mm. So that is 1 centimeter. So you cannot go beyond 1 centimeter of the cholelithiasis, because the patient may end up the chances of CA in a chronic period, it doubles by 20%. So that is why they are advised, the patients are advised with prophylactic cholecystectomy to prevent the CA. But at the rest, if it is within 10 mm, and then we can go for the Kshara karma, and we should be sure that it is within the bladder and it has not moved up to the duct. Cholelithiasis has to be ruled out, and the size has to be ruled out, and the patient should be advised not to take fatty meal where the gallbladder will contract and it may move up and cause the obstruction. Once it is obstructed, then we have to go for cholecystectomy only. So by educating the patient and by examining, and then we can go for the Paniya Kshara treatment.
Ma'am, what about the Kshara Lepana in corn?
Kshara Lepa in corn, usually the Kshara works better because as I told you, the ionization and the depolarization of the membrane works best in the mucous membranes, not on the cutaneous skin, because where our skin is layered by a keratinized tissue, right? So the corn is nothing but our skin is normal skin is done by a layer of keratin. So the action will be not much quicker. And in corn, the tissue is hyperkeratinized. So the potency of Kshara should be more to remove the dead slough, and then it has to go and it has to clear the whatever the small particle is there in the corn. So that is not possible. So we cannot go directly with the Kshara Lepa, but yet we can first we have to do the Lekana with the Shastra like Vriddhipatra, or we should excise it, and then if it is needed, if you think that the healthy tissue is not appeared while doing the excision, then to prevent the recurrence, you can go for Kshara Lepa.
Thank you, ma'am.
I would like to thank the organizers, Dr. B.S. Savdi sir, Principal and HOD of Department of Shalya Tantra, and my dear friend and former colleague, Dr. Geetanjali and her team for giving me an opportunity to share my knowledge in this platform. And I also thank my beloved HOD sir for constant inspiration, and my colleagues and PG students who have helped in preparing all these technical stuffs. Thank you one and all.
Thank you, ma'am. Now I would like to call upon Dr. Geetanjali, ma'am, Associate Professor, SJG AMC Hospital, Koppal, for vote of thanks. Good afternoon to all. ಓಂ ಧನ್ವಂತರೇ ನಮಃ. ಶ್ರೀ ಗವಿಸಿದ್ದೇಶ್ವರ ಸ್ವಾಮಿಗಳಿಗೆ ನಮಸ್ಕರಿಸುತ್ತಾ ಶಸ್ತ್ರಾನು ಅನುಶಸ್ತ್ರೇಭ್ಯಃ ಕ್ಷಾರ ಪ್ರಧಾನತಮಃ ಛೇದ್ಯ ಭೇದ್ಯ ಲೇಖ್ಯ ಕಾರಣಃ ತ್ರಿದೋಷಜ್ಞತ್ವಾತ್ ವಿಶೇಷ ಕ್ರಿಯಾವಚರಣಾಚ. Here, Vishesha Kriyavacharana is one of the important aspect of this Kshara in multi-mode use of Kshara in different clinical cases in surgical as well as clinical practice. And here, Vishesha Kriyavacharana means it can be used in different forms. Either it may be used in Bhasma form or Lepa form, or it is used in the form of Varti or in the form of Kshara Sutra Prayoga. It can be used in various methods. And here, that Kshara and Kshara Sutra, all Ayurvedic surgeons, Kshara Sutra, we consider it as a Brahmastra in treating all anorectal diseases. Here, this Kshara Sutra is one of the is the only Ayurvedic Shalya Tantra treatment modality which is explained in Bailey and Lau surgical textbook. In the first edition itself, in that surgical textbook, it is mentioned for treating that fistula in that to high anal fistula by using this Kshara Sutra. And that is what our that we should feel proud for, that we have that Brahmastra in our sign. And this is the only Ayurvedic surgical treatment modality which is accepted and standardized. Standardized by the WHO usage of this Kshara Sutra in high anal in the treatment of high anal fistula, and that is what our Kshara Sutra does miracles in treating anorectal disorders. And here for this Vishesha Kriya Charanacha, today we have selected the topic, the utility of Kshara in clinical practice in a multi-mode manner. And Madam has did it. Madam has given 100% justice to this topic by showering or serving a feast of knowledge to our all postgraduate scholars and as well as UG students. I'm very thankful to you, madam. And here it gives me an immense pleasure to deliver a vote of thanks on this Shalya Prabodha second guest lecture to 2023. Here firstly I'm very thankful to my guru Dr. B.S. Saudi sir, principal and HOD, department of postgraduate studies and PhD studies in Shalya Tantra, for his unconditional support and encouragement to do such things and to do all the department activities in a very well organized manner. And for that I am very thankful to you, sir, on behalf of our Shalya Tantra department, on behalf of SJGMC college and on behalf of management. And I am very thankful to director Dr. Praveen Kumar sir for his kind guidelines for conducting this online guest lecture series, Shalya Prabodha, in a good successful manner. And I'm very much thankful to our PG coordinator, sir, Dr. Surya Narayan, sir, for his appreciation words and encouragement towards our PG activities. I am very thankful to sir for on behalf of Shalya Tantra department and behalf of SJJMC Koppal. And I thank today's our renowned resource person, guest speaker, Dr. Poornima jalawadi. Today I am very happy that in Shalya Tantra, that Shalya Prabodha second guest lecture was organized in a like a very scientific manner, and madam has accepted our invitation uh, in her hectic busy schedule. Yeah, she has accepted our invitation, and might be all are not knowing, madam is visiting madam is having foreign visit tomorrow. In spite of her busy schedule, she accepted our invitation and delivered a guest speech on a topic, this utility of Kshara in clinical practice. And madam has explained this scientific reasoning for in the preparation of Kshara, that too, that is need of the hour for our PG student. And the madam has given 100% justice in usage and scientific reasoning and usage of Kshara in very rare cases, ectohydronitis suppurativa and poisonic granuloma and all, and in a very well understandable manner she explained it very well. And for that I am very thankful to you, madam, for such a wonderful and session.
Thank you, Dr.
And
Gitanjali.
we are very honored to you, you have, madam. And next, I am very much thankful to my department staff, Dr. Rohit, Dr. Jitendra, Dr. Anisha, and Dr. Sangappa for their support and for in conduction this and organizing in a very well manner of this session, online guest lecture series Shalya Prabodha. For that, I am very thankful to all those my staff, and I am very much thankful to our my postgraduate scholars, and I thank all the participants who has participated in this session. That too, here our college staff
SJJ AMC faculty has joined. I am very much thankful to you all. And from TJMC Ayurvedic Medical College, Dr. Manisha Kandade, Madam has joined. I am very much thankful to you, Madam. And also, I thank all the PG scholars, UG students who has participated in this session. And I thank the persons who are directly and indirectly supported for this successful organization of this event. I thank all of you for this, for your active participation in this session. Thank you, one and all. Now the session will end.
Thank you, ma'am. Now the session ended.